It's the PainExam Podcast with your host, David Rosenblum, MD. If you treat pain or have an interest in pain management, join us as we discuss painful disorders, alternative treatments, practice management, and more. Be sure to subscribe to the PainExam newsletter at PainExam.com and review the podcast on Stitcher or iTunes. Our high-yield premium episodes are now available on the PainExam app with a premium subscription or access for free with a CME subscription at PainExam.com. And now, without further ado, here's your host, Dr. Rosenblum.
Welcome back to the PainExam Podcast. This is your host, Dave Rosenblum at AABP Interventional Pain Care in Brooklyn, where we focus on wellness and comprehensive pain management therapies such as regenerative medicine and more. If you're a patient, feel free to call us at 718-436-7246. If you're a physician looking to get more knowledge, go to nrappain.org, where we offer CME credits for ultrasound training, regenerative medicine training, and board prep for pain physicians and APPs. I want to thank you for joining us. Today we're going to talk about red light therapy for pain. Red light therapy has been used for a variety of conditions, and the big question is, does it work? Is there evidence? And we're going to delve into that. The red light therapy, also known as photobiomodulation therapy or low-level laser therapy, LLLT, is something that you hear about on a lot of alternative pain management podcasts it's becoming mainstream, but it's something that I didn't learn anything about in my fellowship, given my fellowship was almost 20 years ago, so times have changed. But what is red light therapy? Well, it involves the exposing of tissue to low power or near infrared light wavelengths. Typical wavelengths used include the 600 to 700 nanometer red light therapy and the 780 to 1000 nanometer near infrared red light therapy. Unlike ablative lasers, photobiomodulation is non-thermal. Instead, it works through cellular signaling pathways. Photons are absorbed by mitochondrial chromophores, particularly cytochrome C oxidase, which stimulates cellular metabolism and tissue repair. There's several mechanisms of pain relief. Just as an aside, I have pain on and off. I do PRP for it. It works great. However, it's shoveling snow. Unfortunately, it's February. It's March in New York, and we just had a huge snowstorm. So, unfortunately, that activated a few things in my back. So I tried this red light therapy, and believe it or not, I got up feeling much better. Now, the question is, did I feel better because I was just lying down, resting for about 20 minutes, or was there something to this? So we're delving into the mechanism here, and you have mitochondrial activation. The red light therapy increases ATP production within the mitochondria, improving cellular energy metabolism. There's anti-inflammatory effects. The PBM reduces inflammatory mediators such as TNF-alpha, IL-1 beta, prostaglandins. This leads to decreased inflammatory pain. The neuromodulation includes reduced nociceptor excitability, modulates peripheral nerve conduction, reduces central sensitization. Tissue repair is stimulated, the fibroblast proliferation, collagen synthesis, angiogenesis, which may accelerate the healing of injuries. TMJ disorders, well, a randomized clinical trial demonstrated that red LED therapy improved pain and mandibular function in patients with TMJ or temporal mandibular disorders compared with placebo. Patients experienced decreased pain and improved jaw mobility, improved functional outcomes. The reference is De Carvalho et al. I have the links in the show notes. And additionally, clinical trials evaluated 660 nanometer LED photobiomodulation for chronic neck pain, and there was improvements in pain intensity, pressure, pain threshold, cervical mobility, sleep quality. After multiple sessions, this may benefit the myofascial and musculoskeletal cervical pain syndromes as well. Chen et al. Is the reference for that one. As far as oral pain and dental conditions, here's another randomized study evaluating photobiomodulation in dental pain and inflammatory oral conditions, and there was improvements in pain scores, inflammatory markers, and clinical recoveries, and they support it. Almeida et al. Is the reference. There are systematic reviews evaluating photobiomodulation across multiple pain conditions. Report improvements in fibromyalgia pain, musculoskeletal pain disorders, neuropathic pain, and studies can vary significantly in terms of wavelength, treatment duration, dosing parameters, which contributes to heterogeneity of results. Not all trials demonstrated benefit when it comes to red light therapy, so keep that in mind. I'm always wondering about the placebo, right? If you lie there and you relax with red light on you for about 10, 15 minutes, does that help with pain? Well, most likely it does. So the question is there true benefit from red light therapy? And it looks like the results, there is suggestion that there is. However, I think more research needs to be done. Is it safe? Well, yeah, there's a very high safety profile. The side effects are typically mild. They include transient erythema, mild warmth at the treatment site, headache, eye irritation if you don't wear protective eyewear. But serious complications are very uncommon. What's a contraindication? Well, direct retinal exposure, active malignancy in the treatment site, pregnancy when applied over the uterus, and photosensitive disorders. There is a theoretical concern that mitochondrial stimulation could promote tumor growth, but this is not proven. As far as pain goes, it's used for myofascial pain, tendinopathy, cervical pain syndromes, diabetic neuropathy, postherpetic neuralgia, temporomandibular disorders, inflammatory dental conditions. It's used alongside PRP, stem cell therapy, musculoskeletal rehabilitation protocols, and it potentially enhances tissue repair. I've also am aware of people using it for hair loss therapy, I'm not going to get into that here, but there is evidence to suggest it could help with that. A pain board pearl is they may ask about biphasic dose response, which means too little energy, no therapeutic effect, too much energy, inhibitory effect. Therefore, you got to get an optimal dosing. Usually 600 to 1,000 nanometer wavelengths stimulating mitochondrial activity and ATP production. It has anti-inflammatory and tissue healing effects. It shows promising evidence for musculoskeletal and oral facial pain. It remains limited by heterogeneity in dosing protocol, so we have a lot to be determined. The references are in the show notes. So if you are interested in learning more, check out the show notes and the references. I think this still needs more further investigation, whether or not red light therapy is a definitive solution for pain. I'm sure it's helpful, and even just lying there under a nice red light can stimulate some endorphins and work that placebo response, which, hey, if the placebo works, why not do it, right? Anyway, I'm in New York teaching ultrasound every month. If you want private sessions, contact me. Go to nrappain.org. Check out our monthly workshops or schedule a private session for you and your practice. You could also come shadow me. And I am planning a course in Portugal in July, as well as Costa Rica quite often. So if you're interested in any of those venues, please reach out to me. I hope to see you guys in person or at one of the conferences. Of note, Aspen invited me to run their regenerative medicine and ultrasound course with Dr. Ali Vali Moed. You're going to hear more about this on the PainExam or NRAP Academy newsletter, as well as from ASPN. That's in Miami this summer. I hope to see you all there. It's going to be a great course. We do this every year, and it's really a nice experience. Great group of instructors as well as attendees from all over the world who really know their craft and are happy to share their pearls and secrets. And you also have the Latin American Pain Society, which I'm proud to be a part of, headed by my buddy Sudhir Diwan in Brazil this June. And that's going to be a great conference. He gets the top speakers from the Latin American countries as well as United States and elsewhere. And it's really going to be special. So I hope you guys can make it. Once again, if you need board prep, go to nrappain.org or painexam.com. If you're looking for extra training, CME credits, etc. Thanks for listening. If you like the podcast, please share it with your colleagues and write a review on iTunes, Stitcher, Spotify, whatever platform you choose. Anyway, thanks for joining me. If you're a patient looking for more answers to your pain, reach out to me at aabppain.com. If you're not in New York and you just want some expert witness or expert opinion, reach out to me at info, I-N-F-O, at nrappain.org. Take care and have a great day.
Dr. Rosenblum is here solely to educate, and you are solely responsible for all your decisions and actions in response to any information contained herein. These podcasts are not intended as a substitute for the medical advice of a physician to a particular patient or specific ailment. You should regularly consult a physician in matters relating to yours or another's health. You understand that this podcast is not intended as a substitute for consultation with a licensed medical professional. Copyright 2017, David Rosenblum, all rights reserved. No part of this publication may be reproduced, stored in a retrieval system, or transmitted in any form or by any means, electronic, mechanical, recording, or otherwise, without the prior written permission of the author.